Well, 911 calls in Manitou Springs involving things like mental health or substance abuse will now get a different kind of response.
UC Health Behavioral Health Clinicians will now team with police on those calls. Bill Folsom is looking into what's behind this new partnership.
This collaboration between Manitou Springs Police and UC Health mental health pros is about intervening in crisis, but it's also about cutting off the crisis before it happens.
A dispatch to a veteran in crisis. A team with a police officer and UC Health behavioral clinician respond.
We were able to come into his home, sit down with him, and not overreact and not put him in an ambulance and just take him off. That we spent an hour and 15 minutes engaging him in his home.
The result avoided a trip to the hospital. In other cases, it can prevent going to jail.
And make him feel really comfortable. And then we were able to leave him on scene with some follow-up services and some follow-up case management.
We have the options of bringing him to a hospital or place him under arrest, bringing him to jail. With this, it's going to give us the option of having a clinician on scene to speak with him right there.
Manitou Springs Police responded to 760 behavioral health calls in 2022. That's things like mental health issues, substance abuse, and domestic violence. Officers do train for these situations, but collaboration with licensed UC Health clinicians raises the odds of a better outcome on these calls.
That's going to give a lot more knowledge and a lot more experience to the scene.
The goal is fewer arrests and more referrals. It frees up police for other calls, keeps these cases from clogging emergency rooms, and most importantly, gets people in crisis to the most appropriate help sooner.
If you're placed in the back of a police car or in an ambulance, it really can increase anxiety, also can increase finances for someone.
With this pairing, they're going to be able to respond to calls, be closer, be within the community so that we don't have lag times, to get help to these people.
The unit's called Manitou Crisis Response, but the goal goes beyond crisis intervention. They want everyone in the community to know who they are and feel comfortable having a conversation.
If we can be proactive and preventative, I think we can have a great relationship with people in this community.
At the start, these teams will be going out weekdays, then schedules will be adjusted so they can work when they can be most beneficial. In Manitou Springs, Bill Folsom, News 5.